about blood-borne pathogens. But you know, despite all the progress in medical diagnosis and treatments, there are still diseases that resist complete cure. For this reason, it is important that we take personal precautions when we're ill or have cuts or scrapes. This television program is about precautions everyone should take against infections that might come from others. There are a number of disease-causing agents that are present in blood. When such an agent is present in blood, it is called a blood-borne pathogen. You cannot rely on the appearance of people to know if they are or are not infected by a blood-borne pathogen. In some cases, a person can be infected for years without knowing about their blood-borne pathogens. These individuals may not look different from healthy people, but contact with their blood or other bodily fluids could pass any kind of infection. All persons, including teachers, administrators, and other school staff members of all schools, should know the techniques to stop the transmission of blood-borne pathogens that come from any kind of bodily fluids.
Two types of blood-borne pathogens are hepatitis B virus and HIV. The human immune deficiency virus, or HIV, can cause AIDS. Some people can be infected with hepatitis B forever. With HIV or AIDS, all infections are lifelong. When one acquires the HIV virus, it could take a long time for signs to appear. In other words, someone who is infected won't just walk into the room with a sign reading hepatitis B. Understanding the spread of these viruses can keep you from contracting them yourself. Two things to remember is that this disease can be transmitted sexually or by blood-to-blood contact. There are very simple but important tasks to follow to prevent the spread of blood-borne pathogens. These tasks are called universal precautions. The name universal precautions is given to specific tasks to help prevent the spread of these viruses.
Universal precautions are applied universally to all persons. Universal precautions are to be used routinely and consistently. The need for universal precautions can begin before the first bell of school on the way to school. People young and old can be injured or get sick on buses.
Where's the paper towel? Oh, God! Everybody to the back of the bus. Everybody to the back of the bus. We have a situation.
In the case of an injury or illness, immediately put on gloves to establish a barrier between yourself and any blood-borne pathogens. Have students move away from any bodily fluids to prevent any further contamination. Medical help, such as a school nurse, will not be available when the bus is on its route, so the driver must provide aid and do hygienic cleanup. Every school bus should have a first aid kit on board at all times. The kit should contain the following items: a scraper tool, disposable paper towels, hand sanitizer or antiseptic towelettes, gloves and bandages, and plastic bags. After any blood or body fluids have been scraped up or wiped up, disinfect surfaces which were in contact with the fluids. Once you remove visible blood or body fluid, the disinfectant can work properly and is applied to all surfaces that were touched by the contaminating fluid. You may remove your gloves when you have finished assisting the ill or injured person and when all body fluids are cleaned up. In case you have no access to water, use antiseptic towelettes and place the towelette in a bag for proper disposal. When your bus gets to school, use proper cleanup and disposal techniques, and refill all supplies that will be needed for future accidents. The bag containing the waste should be placed in a plastic-lined waste container. Stained or soiled clothing should be placed in a plastic bag until it can be thoroughly cleaned. Always check your school's guidelines for care and tools and materials used during and after first aid cleanup. Remember that using universal precautions will reduce the risk of spreading bloodborne pathogens. By using disposable gloves and cleaning and disposing of any unwanted body fluids properly, you can reduce the exposure of bloodborne pathogens to yourself and to others. Injuries can occur outside, before or after school, or during recess. It is important not to touch bodily fluids. Be prepared to assist students using universal precautions.
First, put your disposable gloves on. Then take your antiseptic towelette and wipe the blood off the wound. Next, spray your Bactine cleansing spray on the wound. Then, place a Band-Aid over the wound. Now dispose of all your garbage in a nice plastic bag. Take your gloves off properly. And put all your items back in the fanny pack. Now, we will both cleanse our hands with our mitts.
Thank you. And as you can see, a student will trip and fall.
Oh, teacher, help me! Ow!
The teacher, using universal precautions, puts on a pair of gloves with the proper techniques. Then, using an antiseptic towelette, the teacher removes traces of blood from the wound and uses an absorbent compound to remove all traces of blood. Then, using a scraper tool, the teacher brushes the absorbent compound away. We can all prevent the spread of viruses using universal precautions.
Today I'm going to show you how to properly remove your disposable gloves. First, grasp the center of your right hand. As tightly as you can, wrap it. Pull it off. With your left hand, squeeze it. Make it as small as you can to where you can't see it. Take 2 fingers from your right hand and bring it under your left glove. Pull it up. Now dispose of the gloves.
Proper hand washing is vigorously rubbing together of hands with warm water. With soap, proper hand washing suspends microorganisms and allows them to be washed away. It's our single most important prevention measure when it comes to fighting diseases because it prevents invisible microorganisms from being carried on the hands. Use warm running water to wet your hands with soap. Rub them for no less than 10 to 20 seconds to clean under your fingernails. Rinse your hands underneath the warm water. Dry your hands with disposable paper towels or a hand dryer. Since you turned on the water before cleaning your hands, turn off the water now by using paper towels or the back of your arm. Then discard your used paper towels. As in any place where groups of people come together, such as school or on the way to school, a small but real possibility of encountering bloodborne pathogens may occur. Remember
that you can come into contact with bloodborne pathogens at any time throughout your day, so it is important to remember to use universal precautions. Create a barrier by using vinyl gloves, follow proper cleanup and disposal guidelines, and always disinfect yourself by washing your hands. With universal precautions, everyone is a winner.